What causes bleeding? Oh, bleeding is caused when there is an injury to a part of the body. Okay, what is an injury? There are two types of injuries. The first is soft tissue injuries, such as wounds and burns. The second are injuries to muscles, bones, and joints. I want to know more about soft tissue injuries. Okay, wounds are open injuries. That means they are easy to recognize because the surface of the skin is broken and blood will be visible. Also, bleeding can occur under the surface of the skin. These closed wounds are commonly called bruises. This type of injury is often minor and requires minor care. But if the injury is caused by a hard impact or a fall from a height, they can cause bleeding inside the body that is not visible. These type of wounds can be serious. If you suspect serious injury, call 811 for the Medical Response Agency of Trinidad and Tobago. If the injury is caused by a high fall, do not move the person. Why is this? Because you can damage their back, neck, or spine. If the person has a bruise, apply cold packs. This will help with pain and swelling. Be very careful with open wounds because germs can get in through the break in the skin and cause infection. Keep the wound clean and protected. Wow. How do you stop bleeding? First thing, always remember to call 811. Severe bleeding must be sorted out immediately. Most minor bleeding will stop by itself, but if it does not, you must take steps to control the bleeding. Cover the wound with a sterile dressing or clean cloth. Press firmly and keep pressure on the wound until it stops bleeding. Next, use a roller bandage to bandage the wound. Cover the dressing completely using overlapping turns. Secure the bandage by applying pressure to the wound and tapping or tying the ends. Keep doing this until medical personnel arrive and takes over. If bleeding continues, apply fresh gauze or sterile dressing and continue bandaging. Do not remove existing gauze. Following these steps will help minimize further injuries and prevent shock. If the wound involves an impaled object, leave the object and dress around it. Removing the object may cause more damage and bleeding. Keep both the object and the body part still to avoid further injury. Place dressing around the object. Press lightly around the wound. Place several gauze around the object to keep it from moving. Apply bandages over and around the injury and object to prevent movement. Use overlapping turns till the object and wound are secure. Can this be done for all wounds to other parts of the body? Yes. And remember, always wear gloves when you are touching a person that is bleeding, and change gloves with every patient you deal with to make sure that you do not spread germs. If you are helping someone and get in contact with any body fluid, please wash your hands immediately. Thank you, Jamal. This is really good information.